and programs. Graduate program, nursing diploma program, pharmacy graduate program, and pharmacy diploma program, which are leading and most favorite program studies for high school graduate. All programs of studies have been accredited by LAM-PTKAS. One has been got very good and the other has been got good accreditation. In Faculty of Health Science, Universitas Muhammadiyah Magelang, the lecturers are qualified lecturers from within and foreign country. Faculty of Health Science has complete facilities with a modern environment and also have support infrastructure, makes conducive atmosphere for learning activity and student activity center. To support the teaching and learning process, there are nursing laboratory, mini hospital, Woundcare clinic, IAG laboratory or natural science laboratory, pharmacy laboratory, chemistry laboratory, library, computer room, and free Wi-Fi in all area. Faculty of Health Science also provides opportunities for students to participate in organizations such as HIMA or Nursing Student Association, ERT or Emergency Rescue Team, HIMAFA or Pharmacy Student Association, INM or Muhammadiyah Student Association, TPM or Student Representative Council, and PAM, Student Executive Board. The graduated students of Faculty of Health Science Universitas Muhammadiyah Magelang can work in the hospitals, clinics, health centers, and health staff in foreign countries, mainly in Japan and Singapore.
So what you waiting for? Let's join us in Faculty of Health Science Universitas Muhammadiyah Magelang.
Islamic, innovative, excellent.
Indonesia, a heaven on earth, the land of immeasurable diversity. And this is Magelang, a beloved land. The universe provides many beautiful places with the wonders of the world. UNIMMA present to be a milestone in facing a more competitive and inclusive era. With the prophetic spirit, ethos, and motivation, UNIMMA is ready forming the quality people based on Islam, affording the excellent graduates in science and Islamic in behavior. Welcome to Universitas Muhammadiyah Magelang. It has 7 faculties with 21 study programs. Faculty of Economics and Business, Faculty of Law, Faculty of Education, Faculty of Islamic Religion, Faculty of Engineering, Faculty of Health Sciences, Faculty of Psychology and Humanities.
Established on August 31st, 1964, UNIMMA continues to be committed in forming an excellent and Islamic generation from which we grown. We have succeeded in building an intellectual community that enriches and enhances humanity as a contribution to the nation.
For the superior generation, UNIMMA is supported by advanced technology facilities for industrial research and development. Standing in a strategic location, our campus is very accessible even for people with disabilities. This is a manifestation of an inclusive educational environment. Maintaining a commitment to the environment and society, UNIMMA always takes concrete actions to create synergy and collaboration with community. In addition, UNIMMA also partners with stakeholders and the industrial sector to facilitate and provide convenience for the students. We realize that every individual is unique with different talents and interests. Therefore, UNIMMA provides opportunities for students to develop themselves to be the best through their interests and talents, both academic and non-academic. We embrace our diversity, growing the future together for Indonesia and for the world. UNIMMA, moving and inspiring.
Faculty of Health Science is one leading faculty at Universitas Muhammadiyah Magelang. Faculty of Health Science Universitas Muhammadiyah Magelang is located on Jalan Mejen, Bambang Sugeng Pertayudan, surrounded by refreshing cool air. Faculty of Health Science Universitas Muhammadiyah Magelang is the development of nursing diploma which was established in 1993. Faculty of Health Science is committed to generate a professional human resource in the health field, educate intellectual generation who are creative and innovative. As stated in the Faculty of Health Science vision, becoming an Islamic, innovative, and excellent at the international level. Faculty of Health Science Universitas Muhammadiyah Magelang has 5 programs of studies. There are Nursing Profession Program, Nursing Graduate Program, Nursing Diploma Program, Pharmacy Graduate Program, and Pharmacy Diploma Program, which are leading and most favorite program studies for high school graduate. All programs of studies have been accredited by LAM PTKes. One has been got very good and the other has been got good accreditation. In Faculty of Health Science, Universitas Muhammadiyah Magelang, the lecturers are qualified lecturers from within and foreign country. Faculty of Health Science has complete facilities with a modern environment and also have support infrastructure, makes conducive atmosphere for learning activity and student activity center. To support the teaching and learning process, there are nursing laboratory, mini hospital, Woundcare clinic, IAG laboratory or natural science laboratory, pharmacy laboratory, chemistry laboratory, library, computer room, and free Wi-Fi in all area. Faculty of Health Science also provides opportunities for students to participate in organizations such as HIMACAP or Nursing Student Association, ERT or Emergency Rescue Team, HIMAFA or Pharmacy Student Association, INM or Muhammadiyah Student Association, TPM or Student Representative Council, and PAM, Student Executive Board. The graduated students of Faculty of Health Science Universitas Muhammadiyah Magelang can work in the hospitals, clinics, health centers, and health staff in foreign countries, mainly in Japan and Singapore.
So what you waiting for? Let's join us in Faculty of Health Science Universitas Muhammadiyah Magelang.
Islami, inovatif, excellent.
Indonesia, a heaven on earth, the land of immeasurable diversity. And this is Magelang, a beloved land. The universe provides many beautiful places with the wonders of the world. UNIMMA presents to be a milestone in facing a more competitive and inclusive era. With the prophetic spirit, ethos, and motivation, UNIMMA is ready forming the quality people based on Islam, affording the excellent graduates in science and Islamic in behavior. Welcome to Universitas Muhammadiyah Magelang. It has 7 faculties with 21 study programs. Faculty of Economics and Business, Faculty of Law, Faculty of Education, Faculty of Islamic Religion, Faculty of Engineering, Faculty of Health Sciences, Faculty of Psychology and Humanities.
Established on August 31st, 1964, UNIMMA continues to be committed in forming an excellent and Islamic generation. From various backgrounds, we have succeeded in building an intellectual community that enriches and enhances humanity as a contribution to the nation.
For the superior generation, UNIMMA is supported by advanced technology facilities for industrial research and development. Standing in a strategic location, our campus is very accessible even for people with disabilities. This is a manifestation of an inclusive educational environment. To the environment and society, UNIMMA always takes concrete actions to create synergy and collaboration with community. In addition, UNIMMA also partners with stakeholders and the industrial sector to facilitate and provide convenience for the students. We realize that every individual is unique with different talents and interests. Therefore, UNIMMA provides opportunities for students to develop themselves to be the best through their interests and talents, both academic and non-academic. We embrace our diversity, growing the future together for Indonesia and for the world. UNIMMA, moving and inspiring.
Faculty of Health Science is one leading faculty at Universitas Muhammadiyah Magelang. Faculty of Health Science Universitas Muhammadiyah Magelang is located on Jalan Mejen Tambang Sugeng Pertayudan, surrounded by refreshing cool air. Faculty of Health Science Universitas Muhammadiyah Magelang is the development of nursing diploma which was established in 1993. Faculty of Health Science is committed to generate a professional human resource in the health field, educate intellectual generation who are creative and innovative. As stated in the Faculty of Health Science vision, becoming an Islamic, innovative, and excellent at the international level. Faculty of Health Science Universitas Muhammadiyah Magelang has 5 programs of studies. There are Nursing Profession Program, Nursing Graduate Program, Nursing Diploma Program, Pharmacy Graduate Program, and Pharmacy Diploma Program, which are leading and most favorite program studies for high school graduate. All programs of studies have been accredited by LAM-PTKes. One has been got very good and the other has been got good accreditation. In Faculty of Health Science, Universitas Muhammadiyah Magelang, the lecturers are qualified lecturers from within and foreign country. Faculty of Health Science has complete facilities with a modern environment and also have secure infrastructure, makes a conducive atmosphere for learning activity and student activity center. To support the teaching and learning process, there are nursing laboratory, mini hospital, Woundcare clinic, IAG laboratory or natural science laboratory, pharmacy laboratory, chemistry laboratory, library, computer room, and free Wi-Fi in all area. Faculty of Health Science also provides opportunities for students to participate in organizations such as UNIMMA or Nursing Student Association, ERT or Emergency Rescue Team, HIMAFA or Pharmacy Student Association, INM or Muhammadiyah Student Association, TPM or Student Representative Council, and PAM, Student Executive Board. The graduated students of Faculty of Health Science Universitas Muhammadiyah Magelang can work in the hospitals, clinics, health centers, and health staff in foreign countries, mainly in Japan and Singapore.
So what you waiting for? Let's join us in Faculty of Health Science Universitas Muhammadiyah Magelang.
Islami, inovatif, excellent.
Indonesia, a heaven on earth, the land of immeasurable diversity. And this is Magelang, a beloved land. The universe provides many beautiful places with the wonders of the world. UNIMMA present to be a milestone in facing a more competitive and inclusive era. With the prophetic spirit, ethos, and motivation, UNIMMA is ready forming the quality people based on Islam, affording the excellent graduates in science and Islamic in behavior. Welcome to Universitas Muhammadiyah Magelang. It has 7 faculties with 21 study programs. Faculty of Economics and Business, Faculty of Law, Faculty of Education, Faculty of Islamic Religion, Faculty of Engineering, Faculty of Health Sciences, Faculty of Psychology and Humanities.
Established on August 31st, 1964, UNIMMA continues to be committed in forming an excellent and Islamic generation. From various backgrounds, we have succeeded in building an intellectual community that enriches and enhances humanity as a contribution to the nation.
For the superior generation, UNIMMA is supported by advanced technology facilities for industrial research and development. Standing in a strategic location, our campus is very accessible even for people with disabilities. This is a manifestation of an inclusive educational environment. Maintaining a commitment to the environment and society, UNIMMA always takes concrete actions to create synergy and collaboration with community. In addition, UNIMMA also partners with stakeholders and the industrial sector to facilitate and provide convenience for the students. We realize that every individual is unique with different talents and interests. Therefore, UNIMMA provides opportunities for students to develop themselves to be the best through their interests and talents, both academic and non-academic. We embrace our diversity, growing the future together for Indonesia and for the world. UNIMMA, moving and inspiring.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It is a pleasure to welcome you today, 11 August 2022, in our webinar entitled Woundcare Management An Update from Complementary Therapist Perspective. Ladies and gentlemen, let me to introduce myself first. My name is Laila Hidayati. I'm a student from the study program in Faculty of Health Science, Universitas Muhammadiyah, Magelang. That will be your host today. Then, before starting this webinar, I would like to thank the Honorable Rector of the Universitas Muhammadiyah, Magelang, Dr. Lili Andriani, Sarjana Ekonomi, Magister Science, the Honorable Dean of the Faculty of Health Sciences, Dr. Heni Setiawati Estirahayu, Magister Kesehatan. A deep appreciation is sent to the speakers in this webinar. First, Sukanya Adisai, Assistant Professor from Prince of Songkla University, Thailand. Second, Mohd Said bin Nurumal, Association Professor from Kuliah of Nursing International, Islamic University, Malaysia. Third, Nurse Estrin Handayani, Master of Arts in Nursing, a Lecturer of Nursing in Universitas Muhammadiyah, Magelang. Fourth, Apotheker Ratna Wijayatri, Master of Science, a Lecturer of Pharmacy in Universitas Muhammadiyah, Magelang. Also, all of the participants who joined this webinar, thank you so much. Ladies and gentlemen, this webinar consists of several sessions. First session is opening session. Let's say Basmalah together. Bismillahirrahmanirrahim. Thank you. And the next session is the recitation of the Holy Al-Quran, which will be read by Firza Yumna, a student of Bachelor Degree of Nursing, Universitas Muhammadiyah, Magelang. Please welcome. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم يا أيها الذين آمنوا إذا قيل لكم إذا قيل لكم تفسحوا في المجالس فافسحوا يفسح الله لكم وإذا قيل انشزوا وإذا قيل واسجدوا فاسجدوا يرفع الله الذين آمنوا منكم والذين أوتوا العلم درجات والله بما تعملون خبير صدق الله العظيم. Wassalamualaikum warahmatullahi wabarakatuh. Now, we will hear the national anthem followed by Mars Muhammadiyah. For the participants, please stand up. All the participants have a seat. The next session is the welcoming speech from the chairman of the committee to Mr. Arif Kusumawardhani, Sarjana Science, Magister Pharmaceutical in Science. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. The Honorable Rector of Universitas Muhammadiyah Magelang, Dr. Lili Andriani, Sarjana Ekonomi, Magister Science, the Honorable Dean of Faculty of Health Sciences, Dr. Heni Setiawati Esti Rahayu, Sarjana Keperawatan, Magister Kesehatan, the Honorable Head of Undergraduates and Diploma Program in Faculty of Health Sciences, the Honorable Speaker Associate Professor Mo Said bin Nurmal from Malaysia, the Honorable Speaker Assistant Professor Sukanya Dets Adisaib from Thailand, the Honorable Speaker Nurse Estrin Handayani, Sarjana Keperawatan, Magister Art in Nursing, the Honorable Speaker Pharmacist Ratna Wijayatri, Master of Science from Indonesia, and the Honorable all of participants who attend this event. Good morning, ladies and gentlemen. Praise to Allah Subhanahu wa Ta'ala has given us health, so that we can gather this morning. Salawat and salam to the Prophet Muhammad SAW, who can guide us with the light of Islam and science. Ladies and gentlemen, my name is Arif Kusumawardhani, and I am the chairman of this webinar. First of all, I'd like to thank you all for joining this national webinar on health sciences in collaboration with Indonesian National Nurse Association, the Indonesian Pharmacist Association, Prince of Songkla University, Thailand, and International Islamic University, Malaysia. It is great pleasure to meet you all here. This year, we do the seminar virtually in response to the complementary and alternative medicine camps are widely used by the general public. Natural products including plant-derived extract and naturally derived substance are an important component of CAM. Here we review the evidence for this use in Woundcare. So therefore, the theme for our webinar is the Woundcare Management and updates from complementary therapy perspective. We believe this is the most suitable topic we need to address at this very moment. We see the urge to allow scientists, academicians, and health workers to discuss and share their view and research on this. I'm looking forward to hearing a discussion for you all. In the session for this stage, your participation is very much appreciated. I'm proudly announced that we accepted a lot of participants. And our participants come from different institutions. And the last, I'm working with my committee. They are very good. Some of you may have been contacting with us in the last month, and I will do the same in the one case. So if you have any question, please do not hesitate to contact us. We are here for you. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. The next session is the opening speech from the Dean of Faculty of Health Sciences to Dr. Heni Setiawati Esti Rahayu, Magister Kesehatan. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahirabbil alamin. Wassalatu wassalamu ala asrofil anbiya'i wal mursalin wa ala alihi wa sahbihi ajmain, amma ba'du. Our honorable all the speakers, Assistant Prof. Sukanya Dej Adisai, Associate Professor Muh Said bin Nurumal, and our honorable two beautiful speakers, Mrs. Estrin Handayani and Mrs. Ratna Wijayatri, our honorable the Vice Dean of the Faculty of Health Sciences, Universitas Muhammadiyah Magelang, our honorable the head of the study program at the Faculty of Health, Universitas Muhammadiyah Magelang, our honorable all webinar participants. Let us praise the presence of Allah for His mercy and grace so that we can participate in this webinar activity in a healthy condition without lacking anything. Salawat and greetings may always be poured out to the Prophet Muhammad Sallallahu Alaihi Wasallam. Ladies and gentlemen, the webinar with the topic Woundcare Management, an update from complementary therapies perspective, which helped to support the excellence of the study program, namely Woundcare, complementary therapy, and natural ingredients. This webinar also brought speakers from nursing and pharmacy as a form of interprofessional collaboration, IPC. There is an increase in complex patient problems that require the skills and knowledge of several professionals. Good cooperation and collaboration between health professions is needed to increase patient satisfaction in providing health services. In addition, ICP is useful for improving efficient and effective health services. Collaborative practice between health professionals can also reduce the risk caused by the length of healthcare, such as reducing the number of patients with complication, length of stay in hospital, conflict between patients, rotation of health workers to patient mortality. ICP is also very necessary because there is still an ego in each profession. This webinar also presents speakers other than domestic as well as from abroad in accordance with the tagline of the Faculty of Health Sciences, namely Islamic, innovative, and excellent at the international level. Hopefully, this webinar will be useful for all participants and ultimately be useful in improving the quality of services to patients. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. So, ladies and gentlemen, we are now at the main session of this meeting. And the next session will be hosted by Mr. Sumarno Adi Subrata, PhD. He is a nursing lecturer at the Faculty of Health Sciences, Universitas Muhammadiyah Magelang, and one market consulting, Upper Hayford, Chester, United Kingdom. He is graduated from Doctor of Nursing program in Mahidol University, Faculty of Medicine, Ramatibodi Hospital, Thailand. He is also the reviewer in several international journals. There are Malaysian Journal of Medicine and Health Sciences, Journal of Advanced Nursing, United Kingdom, PMC Primary Care, United Kingdom, etc. He is also a member of Woundcare Alliance, United Kingdom, and the research that he has done for the first, the need for integration nursing theories into pressure ulcer care in community accepted for publication. Second, diabetic foot ulcer care during the COVID-19 era, integration of Henderson's for the needs theory, accepted for publications. So, all right, Mr. Adi, the time is yours to be the host of this webinar. To Mr. Adi, please welcome.
Okay, thank you Lala for your kind introduction. Assalamualaikum warahmatullahi wabarakatuh. Right, ladies and gentlemen, welcome to our webinar with the topic is Woundcare Management An update from the complementary therapy. And in this webinar, we have 4 speakers that coming from Malaysia, and then from Thailand, and also from Indonesia. And let me introduce the speaker first. This is Mr. Moh Said bin Nurmal. Mr. Said, can the sound be clear with you?
I can hear you very clear. Can you hear me?
Okay, thank you so much. Thank you so much. Okay. Mr. Said, you will be the first presenter in this webinar. So are you ready? Okay.
Yes, I am.
Okay. Before he present this slide, I think I would like to show her profile. So please show her profile. Okay, just a minute. Okay, he is Dr. Moh Said bin Nurmal. And he's a nursing lecturer in the National Islamic University of Malaysia, and he has several qualifications and is a global head nursing leadership program in 2021, and also he graduated from the Chiang Mai University in 2014. And then he has a lot of experience in nursing area. And for example, in 1st January, he has several achievements in academic. And then he also a male nurse in University Malaysia Medical Center. And also he get an assistant professor from the University of Malaysia. And also he has several publications in academic journal, and also I think he is very expert in a nursing area. Okay, Mr. Said, you will have 30 minutes for a presentation, and the time is yours to present the slides.
Thank you very much indeed, Brother Sumarno Adi, for your very kind introductions. Okay, as I been addressed, my name is Muhammad Said Rumal. I also would like to thanks to the entire secretariat and team of University Muhammadiyah Magelang for inviting me to this wonderful seminar, perhaps a web seminar sharing about wound. Okay. And I also like to thanks to Sister Nia, who are communicating me for the last few days to make sure things are smooth taking place for today's event. Ladies and gentlemen, brothers and sisters, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I'll be sharing topics on a very basic and fundamentals about wound, which is a wound healing process. I think you will have a wonderful experience today with various wonderful background of speakers who are telling more on the complementary, but let I share with you what are the fundamentals, the factors, the basics information about the wound healing process. Therefore, you will get a better understanding. Okay, I will then start sharing my screen. Or okay.
Okay, I think the slide is, we can see the slide.
You can see the slide right now. Where I go for, okay. Can my slide be seen?
Can you make it a bigger when in the slide?
Bigger, right? Okay, display, okay. How about now?
Okay, I think it's okay.
Is it getting, I think it takes some time to, okay, I go for my second slide. Is it the slides getting, is it zooms or is it still? Okay, display setting. How about now?
Yes, I think this is okay. You can.
Okay, I'll be talking about a wound healing process. Okay, wound healing process, basically it has primary intentions. We call healing occur when a wound has a little or no tissue lost. Then it has a delay. 1 second, I need to remove this. Okay. Then it has a delay in primary intention. Healing occurs when significant tissue loss can be repaired surgically with a skin or muscle graft. And the second intention describe the process of healing a wound without the benefit of surgical closure. So this is what a wound healing process is. Okay. Sorry, why it can't select. It's not moving. Okay. Back now. Sorry. Okay. Okay, so the process of wound healing begins at the moment of injury and may continue for years. So I think you really need to understand this. Maybe you will say why he say for years, why he never say for a couple of hours or couple of days. This is what we call the ultimate process of wound healings. Okay, but no matter how trivial or extensive the wound, healing always include 3 overlapping phases, which is inflammation, proliferations, and differentiations. I think this is very common, you understand, but we will go deeper more and discuss on the healing process. Okay. The inflammatory phase, I think all of you know, all of us will experience having wounds, and you know what are the next happening on your skin when the process of inflammatory phase are taking place. The main function is to initiate the wound healing cascade, remove the debris, and prepare the wound for the regeneration of the new tissue. The inflammatory phase is characterized by the local erythema, edema, and the tenderness. Okay, it's quite common, regardless it's a wound of trauma, or wound of surgery, or wound of pressures, or whatever types of wounds. Yeah. Okay, then the second is we call a proliferative phase. Okay, the proliferative phase of wound healing overlaps the inflammatory phase. This overlap the inflammatory phase. It begins 2 to 4 days after wounding and lasts for approximately 15 or 16 days. Okay, if you go back to the basic of surgery, after the wound inspection, they say day 3, and they were doing STO of day few days, 7 up to 2 weeks. These are all the reasons behind. Yeah, the main event during this phase are depositions of connecting tissue and collagen cross-linking, which fill the wound with collagens and provide the strength. So along with this phase, what we call the proliferative phase, there also are things that you need to understand clearly what are happening along with these proliferations. Number one is the granulations. During collagen production, new capillaries are forming as bud-like structure. Capillaries penetrate the wound and carry nutrients to the newly generated tissue. So cut story short, any blood vessels has oxygens, has nutrients. Any healthy blood vessel have oxygens and have nutrients. This is a very important requirement in order to have the wound healing. So you understand these are basic things. So granulation tissues, when kept moist, provide good tissues for advancing the epithelial cells. So this is how things getting healthier. Okay, as much as the synthesis of collagen decreases, the new vascular channel regress, the wound transforms to a comparatively vascular and cell-free scar tissue composed of densest collagen bundles. So these are when a granulation process are taking place. Along with this, the epithelial cells migrate from the wound margin across the wound surface to create a watertight seal over the wound. Yeah, fibrin strands function as a scaffolding, over which the self-creeps sheet of new epithelial cells continues to grow until they can come into contact with other moving across the wound from other direction. I think the pictures are giving you some ideas how the process of this happens. Yeah. So along with this, it has a few way of healing too. Either it's a primary or secondary. So the primary healing, where the fibrin closes the wound within a few hours and the epithelialization begin in 1 to 2 days. It depends on how severe your wound are or how damaged the wound area are. Okay, secondary healing migration of cells is rapid at first, but gradually slow days or weeks may elapse before epithelialization is complete. If a scar is covering the wound surface, the epithelial cells must migrate underneath the scar. Okay, these are what the process happens. Then contractions. The scar in the wound that has healed by secondary intention shrink by a process called a wound contractions. It begins on about the 5th day. Secondary intention healing continue for a month or even a year. So this is always we call maximum 3 years. But generally, it could take a couple of days, week. But you again need to know, I didn't touch the word here, how deep the wound effect or trauma also influence the process of healing. Okay, I believe that if type of burns, depend the degrees of burn or chemicals, all are having a different way of healing. Yep, in terms of durations. So the differentiations of phase, the wound matures and the collagen in the scar undergoes repeated degradations and resynthesis. This is the longest phase of wound healing. The tensile strength of the scars increases between the 1st and the 14th days. Tissue regain approximately 30% to 50% of their original strength. I think you know what does the strength refer here, that ability to use as a normal functions. If you're newly recovered, you feel like a bit hard to use as maximum as compared as your originals or non-unwound area. Am I right? So these are the kind of information. So tensile strength continues to increase the approximately 80% of normal tissue strength later. So wound never completely regain the tensile strength of unwounded tissue. Okay, this is an example I've given earlier. So this is a very important pictures that you really need to understand. It depicts that how the process of wound healing taking place. If you look that it has up to 100 days, like but we talk about months, not years here. Orderly phases of wound healing, and you see the factors of all these is collagens. Okay, if you're having a good collagen production in your body, things getting better. So you all agree that number one, the process of inflammation occurs, then granulation, then a wound condition. So this cut story short, this is how the process that you need to understand, regardless of what type of remedies you use for the wound, this could influence the duration. So the only evidence can say what remedies shortens the healings. We will see along your research work, perhaps. Okay, besides talking about the physiology roles or of in wound healings, as I've described in my last few 10 minutes about slices of process of healing, but there's another thing that you need to remember as well, factors affecting the healings. Healings influenced by systemic condition or by local condition in the wound. Okay, this is a thing that you need to understand. In earlier, I believe the capillaries carry oxygens and nutrients, but in the context of this, the other factors could also delay or fastens the wound healing. Okay, there are tissue oxygenations, stress, advanced age, or called older group of people, nutrition, and infections. So we will go one by one and explain to all of the audience to make a better understand the cost of wound healing by these factors. Tissue oxygenation is a very essential for wound healing, regardless of what types of wounds that you are talking about. The nutrients and the oxygens are paramount importance to make setup of this. Okay, so if you don't have this, definitely delay. Ask yourself, if you're fasting, you don't have a good environment of air, oxygen, food, how do you physically feel? The same of our tissue organ too. Okay, blood flow supplies the wound within oxygen nutrients. Blood flow remove carbon dioxide and metabolic byproducts. Any conditions that reduce the blood flow to a wound, such as arterial occlusions, diabetes, or vasoconstriction, or constriction, or external pressure, impediments the healings. So please, 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 when you have a wound, don't overpressure it. When you overpressure it, poor circulation. If there's poor circulations, poor oxygens and nutrient supplies to the particular areas. Let me go to the second factors, stress. Sympathetic nervous systems and adrenal response to stress. Okay, it's a neural, hormonal, or metabolic changes can impact wound healings. In general, in reality, wound can very much influenced by your well-being states, your emotion state. This is very important as healthcare provider. Certain wound in the certain cosmetic area, even your certain, like open area, you only need to motivate, you need to teach about hygiene, the care, everything to your clients. Then therefore they will have a motivation rather than having stress, because it brings the delays of the wounds healing. A plan that provides sleep and rest for the patient with a pressure ulcer, for example, will promote a wound healing rather than ignore of all these things here. Advanced age. Okay, this is another factors that you need to understand. A younger, let's talk about fractures concept. When children having the fracture, the process healings are very fast as compared to the older people who are having fracture. I think the same principles apply in over here. So, okay, so aging affects almost all aspects of the healing response. Okay, slowing epidermal turnovers and increasing skin fragility together reduce wound healing by factors of 4. Yeah? So the repair rate decline with failing rates of cell proliferations, lack of development of wound tensile strength, impact collagen depositions, and wound contraction. So basically, these are the causes of advanced age. Moreover, medical conditions occur mainly elderly persons, which adversely affect healing. I think you all know there are many diseases. One of very common is diabetes. Okay, the elderly tends to be malnourished and poorly hydrated and have compromised respiratory and immune functions too. Okay, I think we all agree your blood vessels, your tissues, your cells require and have these nutrients and oxygen as well. Okay. Loss of dermal and subcutaneous mass increases the risk of pressure-induced tissue injury as well. Like, I think you all know the wound, the skin triggers among the oldest are gone, yeah, because of the degenerative process. So, do we really have malnourished in the context of wound healing? It's not talking about malnourished or poverty per se, but when you don't take a proper nutrient as well can cause the wound healing delays. Yeah. So wound healing and the immune response both require an adequate supplies of various nutrients, including protein, vitamin, and mineral. I think all of us know the basic types of what nutrition source is a proteins to make the wound is healing. Like a high protein, good vitamin E and vitamin C also are required. Okay, loss of more than 50% of lean body mass interferes with the wound healings. Okay, so this is what we call when you are sick, when you have illness, you are autoimmune, you indirectly create a malnourished context of your skin, your body. Yeah. So individuals with chronic wound may need more proteins and calories than the recommended daily allowance. And may require dietary supplements. So please take note, these are very important. The diets where you skip of having those proteins source, then you delay in indirectly bring delay in the wound healing. Yeah. So protein, one of the very important is a low serum albumin level, lead manifestation of protein deficiency. Serum below of 30 grams deciliters are an indicator of poor nutrition status. So serum concentration below 2.5 grams deciliters reflect severe protein depletion. Yeah? So I think you all know what is protein. Protein is a mix, also lentils, yeah, or soya base. So vitamin C deficiency will impair our fibroblastics function and decrease collagen synthesis, which delay healing and contribute to breakdown of old wounds. Yeah, so it's a very important that you really need to know. Vitamin C's intake or increases can increase also the productions of the collagen, which is very important in the very first phase of the in the wound healing. Deficiency causes loss of resistance to infection. It's water soluble and cannot be stored in the body. So if you take many, you will just absorb. Yeah. So vitamin A and mineral is associated with retarded epithelialization and decreases collagen synthesis. Deficiency is uncommon because it's a fat soluble and it's stored in the liver. Other vitamins such as thiamine and riboflavin are also necessary for collagen organization and the resultant tensile strength of the wound. Various minerals such as iron, copper, magnesium, magnesium, and play a role in wound healing as well. So this is what are the things that you need to understand when talking about wound. It is not a direct healing process, or we call natural healing process, or you will just think about treatment that you're given, but you need to associate with all the factors that I've highlighted. Okay. The barrier of healing, this is where people who have been autoimmune, people for immune compromise on the drugs, corticosteroids suppress the inflammatory response. Inflammation is necessary to trigger the wound healing cascade. So you might be very confused. You say that, what? I thought that inflammation is taking steroid. But look here, we are not talking about acute treatment, we're talking about long-term treatment, yeah, chronic care, where this can give the other effect, which is suppress the inflammatory. Yeah? Steroid therapy began after the inflammatory phase of healing, usually 4 to 5 days after wounding, has a minimal effect on the wound healing as well. Though generally steroid is the cure of the inflammation. Okay, this is another point as well. Smoking. Okay, smoking, nicotine interferes with the blood flow. It is a vasoconstrictor. It increases platelet adhesiveness and causing clot formations. When it happens, clot formations, poor supplies of the oxygen and nutrients. Okay, cigarette smoke in the vasoconstrictor and contain carbon monoxide and hydrogen. Yeah. Diabetes, yes, I've highlighted earlier. Diabetes, a high level of glucose compete with the transport of ascorbic acid, which is necessary for the depositions of collagen. Okay, tensile strength and cognitive tissue production are significantly low with diabetes. Arterial occlusive disease can impair healing. Reduced sensation may leave wound undetected. Patients with diabetes have more difficulty resisting infection, and their wound heal more slowly than the diabetes patients. Okay. Infection, the last factors, infections, complication of pressure ulcers, for example, include sepsis and osteomyelitis. They are old, that could be a risk as well. Debridement, drainage, and removal of the necrotic tissue alone control most infection. Open wound does not have to be sterile or to heal. Healing cannot proceed until all necrotic tissue has been removed from the wound. So please take notes, my dear colleagues, brothers and sisters. When you are taking care of the wound, you expect to have a wonderful wound healing. Please make sure that all the dirt has to be clean. So this is another important information in wound healing as well. Okay, that's why you need to go to the healthcare provisions for the treatments and do the best necessary. Parenteral antibiotic are indicated only when signs and symptoms suggest, so like these sepsis or we don't start giving directly antibiotic as a treatment. Some do for prophylaxis role. Yeah. So wound dehydrations also can occur. Wound healing occurs more rapidly when dehydration is prevented. Epidermal cells migrate faster. I told you earlier, if you're fasting, you're not taking waters, you're very big. Same goes to the wound. Yeah. So epidermal cells migrate faster, covers the wound surface sooner in the moist environment than under the scalp. So what is all about healing the wound and then evaluation of the healing as well. So very important as a healthcare provider, because you are pharmacists, you are doctors, or you are nurse, even you are caregivers at home, or even you yourself doing the self-care, evaluation of healings requires a good understanding and comprehensive knowledge to make sure that you know what are the best or next step required. Use a systematic and consistent methods to record wound assessment. Examination should include measurement of the wound length, width, and depth measured in centimeter or millimeter, observation in inflammations, aggravation and epithelialization as well. Yeah? Wound healing, whenever possible, the body should be allowed to heal itself. I know, I all agree this. It should happen naturally, but you need to support all the others to make it goes a better outcome. Yeah, the best treatment is to support conditions that promote optimal healing, such as protection from the trauma and maintaining a moist environment. So assessing the risk is number of time of medical diagnosis that you need to know. A person's with diabetes or autoimmune or immunocompromised or delays, presence of chronic heart problems, you are less moved, and then kind of etc. Chronologic age, immobility, you make steps or delay as well. Yeah, all these move independently. Mental status, adherence are very poor. Nutrition status lead to malnourished. Incontinence, incontinence also can cause wound effects here because it water the bed. For example, presence of infections and adenocarcinoma circulation. So the risk factors, immobility, probably the greatest trait for pressure ulcers. I'm talking about in the patient context. Incontinence as well, I highlighted earlier. Mental status too, stress, all of the risk factors that you need to be extra careful. Let's be talking about nutritionals, dental health is very important, oral and GI histories, chewing and swelling abilities. All of these are important because they will make taking good ingestion, good healthy food, like how to take a protein if you don't have a good take, for example, quality and frequency of foods food eaters, involuntary weight loss or gain, serum albumin level as well, the factor of protein, nutritionally pertinent medication, psychosocial factors affecting nutritional intake, and etc. Okay. So laboratory tests depress serum protein, serum albumin, and transferrin level together, indicate poor urinary receptors, body weight at risk. Patient should be weighed weekly, notify a physician, nurse, dietitian if there is an unintended loss of 10 pounds or more during a 6-month period. A change of 5% body weight is predictive of drop in the serum albumin. So there are a few skills that you can use here to measure how effective your wound have healed, the process, etc. One are very common called Norton skills, with physical condition, mental state, activity level, patient mobility, and incontinent arm skills. It's very good for older people or for geriatric and managing pressure ulcers as well. So you got skill 1 to 4. Remember, it covers physical condition, mental state as well, and mobility despite of the wound itself. Total score range from 5 to 20. The lower the score, the higher risk of ulceration happen. Is simple and easy to use but does not include nutrition. The other skill is a Braden skills. The Braden skill has a 6 sub-skills divided into 2 categories. This is talking about the tissue tolerance as well as the intensity and duration of the pressures, which cover on mobility, activity, and sensory perception. And then for talking about tissues, we're going for moisture, nutrition, and friction of shears. Okay, these are all the risk assessment skills that are available for the practice. Okay, so now you all know about assessment, right? You all know about how to express the looks of the wound. So we start with skin inspection. So pressure intra-blood flow causes pallus. Pallus reflects tissue ischemia. Skin should be quickly returned to its normal colors. Okay, with relief from pressure as blood flow returns. First external sign of ischemia, the skin becomes redness after the pressure is removed. A bright flush generally lasts for half of 3/4 of the duration of ischemia. Vessels are dilated and the amount of blood available increases for nutrition, oxygenation, and removal of the waste product. So a blanchable erythema, okay, where the white cut of skin pallor looks here. For in light skin and dark skin, I'm giving 2 examples. In light skin, compressing the retinal area cause the color to blanch or turn pale, the white looks here, the light yellow looks. Red immediately after compression is relieved, cause no long-term effect of the tissue, should return to its normal color within 24 hours. Okay, so in dark skin patient, comparing skin on the contralateral sides can help in assessment of subtle color change, palpate for increased warmth, a feeling of tightness, and areas of hardness under the skin. So for non-blanchable erythema, this may be the first outward sign of tissue destruction as the tissue are deprived of oxygen beyond the critical period cells die. Non-blanchable erythema is reversible, is recognized at early treatment. So these are examples. I focus on the one type of wound, which is the pressure type of wounds here. So all to all, I end my sessions by highlight that the things that you need to know about wound healing process, or the way how to heal the wound at the maximum outcome or the most benefit looks or impact that you want is healthy skin require a holistic approach. Routine skin inspection is a must. Stage and manage any wounds require. Use a team approach. Not only you with the various healthcare teams, but can give you an idea. I believe in this seminar we will talk about complementary, which is another platform to make sure the wound can heal fast. And of course, last not least, monitor. We also can empower the individual for monitor. I think with that, I end my session, my presentation. I hand over back this to Brother Sumarno Adi. Thank you. Assalamualaikum.
Okay, thank you so much, Dr. Mo Said bin Nurmal. There was a very interesting presentation, and you already discussed about the basic of wound healing and also the factor that affected wound healing. We will have some question, but after all the speaker discuss the topic. Okay, so would you mind to stay with us until the event is complete?
Inshallah, I'll be with you all. Thank you.
Okay, thank you so much. Okay, now we move to the second speaker, and she's a nurse Estin Handayani, Master Art of Nursing. And before she present her topic, I would like to present her profile. Her name is Estin Handayani, Sarjana Keperawatan Master of Art in Nursing, and she is a lecturer in medical surgical nursing and have a lot of publication in burn. And she's graduated from the Philippines. And also, he has 7 publications in international journal, and also write some book chapter in medical surgical. And also he also done in professional training in a wound care and also disaster management. Okay, Mr. Estin will talk about the burn management in nursing, and you will have 30 minutes to present your topic. Okay, now the time is yours.
Thank you for the time, Mr. Adi. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Good morning, all the speakers. Today, I'm the second speaker, and I'm a lecturer in medical surgical nursing, Faculty of Health Sciences, Universitas Muhammadiyah Magelang. And today, my topic is about wound management of burn injury. And the first one, we have 4 outlines for today. The first one is discuss about the pathophysiology of the burn care and the classification and the common causes of burn. Okay, thank you. The slide. And the second is the first aid for burn in the second slide, please. Okay, we're waiting for the slide. Okay, the third is the nursing management of patient with burn, and the last is about the review option about the treatment based on the research. Next. Okay, in the very beginning, we are talk about the skin structure first before we are going to burn injury. We know if the skin have 3 layers. In the upper layers is the epidermis, and the top layer of the upper layer skin that you can see and touch, meaning you can touch your epidermis, and have a keratin as a protein inside skin cells. And the second layer in the middle layer is dermis. The dermis makes up 90% of the skin thickness and has collagen and elastis. And the bottom layers is hypodermis. The bottom layers of skin or hypodermis is the fatty layers. So we cannot see the hypodermis because it's deep in the skin. Have a cushions, muscles, and the bones. Next. Okay. The function of the skin, the first one is barrier to infections. And so there's no kind of the pathogen cat going inside in the body. The second is protection for external injury. The third is temperature control and the control of the body fluids and the sensory organs. Okay. What is the next? Okay, we are going to talk about the wound with the burn care. What is the burn care? Okay, sorry. The burn is injury of the skin or other organic tissue primarily caused by heat or due to the radiation, by heat, electricity, chemicals, friction, or radiations. So the next slide, we are discuss about the common causes of the burn injury. The common causes, next slide. What is common causes of the burns? There is, you can see in the slide, The most common causes in from fire or flame, the number score is 43%, and number 2 is the scalding. Scalding 34%. Scalding is like hot water or boiling water or like a steam. So we can be more careful for these causes because the children have to high risk for these causes. Okay, the first one is chemical causes. The chemical causes, this type burn is caused when living tissue is exposed to corrosive substance. That's meaning the chemical burns are injuries to the skin, eyes, mouth, or internal organ caused by contact with corrosive substance, such as acid or base in the chemical. And they may also be called caustic burns. Is the same name with chemical burns. Chemical burn can happen in the home, at work, or at the school. Maybe in the laboratorium if you are have some practice for some corrosive substance and have the accident. We can get the result for the accident in chemical burns. Okay, the second one is by electrical burn. This is the second common causes. This occur with the faulty electrical wiring, and it might not be visible, but can cause critical internal injuries. And an electrical burn is the skin burn that happens when electricity comes in the contact with your body. When the electricity comes in the contact with your body, it can travel through your body. When this happens, the electricity can damage tissue and organ. This damage can be mild or severe and maybe even cause a death if the fault or the resources is more highest fault. Okay, the third one is from radiation burn. A radiation burn is the damage to the skin or other biological tissue and organ as an effect of the radiation. It's occurred due to export to radiation. Most common type of radiation burn is sunburns. Like you can going to some place or beach, you can you cannot to wearing your t-shirt or some clothes, you can get radiation burn because of the sunburn. Okay, the radiation type of greatest concern are thermal radiation or radio frequency energy. Okay, the fourth is scalp burn. This is the common causes for burn injury. This is for burn from heat fluid such as hot oil, boiling water, or steam. Like you can more careful if you have some activity in the kitchen. Maybe you can boiling water or steam. Maybe the high risk in the children is more affected for her or for his children. Okay, we continue to type of classification. In this classification, we have two bases, and the first one is basis of depth, and the second one is basis of the severity. You can see the basis classification of burn based on the depth is the first one is first degree, and the second is superficial partial thickness, and deep partial thickness, and full thickness. And we can also the second degree, third degree. And the other one is on the basis of severity. This have three categories. The first one is burn minor, moderate, moderate burn, and major burn. Okay, we can explain the first one is first degree burns, and or we can call the superficial. This is epidermis affected only. So we, in the first beginning, we know we have three layers: epidermis, dermis, and hypodermis. So in the first degree, in the epidermis only with affected for this burn. And the second, for the first burn is like the skin is red or pink, dry, painful, blunt to touch. Okay. Before epidermis is spontaneous healing within 7 days. Outer injured epithelial cell peel and seldom clinical significant. So we can just minor, like a minor burn is the same with the first degree burn, because only the upper layer for the skin affected. Okay. Superficial partial thickness. This you can see is entire epidermis and portion of dermis, papillary dermis. So we can know the affected in the layer of dermis and the little of the layer of dermis. The superficial partial thickness is painful. The characteristic of this part, and they have a blister, and the blister is like you can see in the bottom one is like bula is blister like this what is called this some water inside in the skin, blister. And hair usually intact and does not scar my different pigment. Okay, in the deep partial thickness, we can see the reticular dermis, mostly red and white. The color of the skin of the patient with burn injury is mostly red and white. No painful or pinprick or the pressure. So if we going to assessment for the patient with the injury in the part of deep partial thickness, we could not ask the pain management or the pain level, because there is no pain level for this part of the burn. Usually have the scar after this stage. Usually we have scar after injury, and need to exercise and grafting, or like surgery for the skin grafting, and healing wound is more than 3 weeks. Okay, in the last one is full thickness, third degree, and this all the layer is affected. Start from epidermis, dermis, and hypodermis, and also almost to the muscle. In the bottom one, in the layer of the burn is affected also in the muscle. May go into fat on deeper is like with the deep partial thickness. In the full thickness stage or third degree is also have color of the skin sets red, white, brown, sometimes black. You can see in the bottom one in the right is also black, and inelastic and painful. So the same with the before. Deep partial thickness is there is no pain level or painless. Always also have excise or skin grafting. So if you assessment to patient in the emergency care, we have assessed and the patient already get the degree, the partial thickness or third degree, we can just going to management for emergency care and then going to surgery or surgical room, like we can get skin grafting immediately. Okay. And the basis of the severity, this is this same classification of the burn, the basis of the severity given by American Burn Association. We have 3 category with the base of the severity. The first one is minor burn, and the second moderate burn, and the major burn. In the first one, minor burn is have characteristic of the minor burn is lower than 10% TBSA burn in adults, like total body surface area burn in adult is lower than 10%, and lower 5% TBSA burn in younger or older patients. So we can different age for the adult and the younger or the older patient. And the lower than 2% full thickness burn is called minor burn. And the second one is moderate burn. In the moderate burn, we have characteristic the second burn of 15 to 25% for total body surface area. And for this for adults, and for the children, lower than 10 to 20% total body surface area in the children. Is different cases, but it's called like moderate burn. And characteristic in the second one is third degree burn of the TBSA or lower than 10%, without involvement of the special area like eyes, ear, face, and perineum. So if you have some patient in the emergency case, you get some result in special area like eyes, ears, face, and perineum. You can call in moderate burn, not like in minor burn, because the vital area we call in moderate burn. And the last is major burn. They call major burn if second degree burn is more than 25% of total body surface area or TBSA in adult, or more than 20% TBSA in the children. We know if we have the rule of 9 to count the TBSA is different percentage for the adult and the children. So we have different characteristic for the major burn between adult and children. So all the third degree burn more than 10% TBSA, and all burn involve special area. So if you have a special area like before in the moderate degree, like eyes, ear, face, hand, and perineum, also can cause major burn. And all electrical injury, inhalation injury, and all poor risk the patient. Okay, we are going to the next about burns first aid. Some case, if you have accident in the home or at the work or in the office, if you have some accident for burn, this is going to do for first aid. The first one, before we going to cooling, call, and cover, the first one is important is remove all jewelry from around the burn area. So if you have jewelry like rings or some thing like other jewelry in your body or the body patients, you can remove any clothing and nappies around the burn area. And the second is you can cooling in the running water, not to ice water or cool pad. The inside is cool water, cooling. So cool water is not allowed to first aid. Just to the burn under cool running water for no more and no less than 20 minutes. So we can just found the running water and we can just cooling the burn injury, like minor injury or moderate injury in hands or the other area, no less or no more than 20 minutes for the first aid. And the next is the cover. Number 3 is the cover the burn losing with the sling wrap or the clean. This is meaning after you have removed all your jewelry from outside your body and the cooling in the running water about 20 minutes. After that, you can cover of the wound burn injury. So if you have like a plastic or something, you can wrap the burn injury. So we know if the burn injury is like the open of wound, so the high risk for the more infection come into the burn injury. So we need to cover the burn. After that, we can call for the medicine to going to hospital or just going to some place for the get the medicine. So John, we have no what is don'ts for burn. Do not offer cool closely. So if you have cooling the burn injury, not so cool the water, and do not give casually alcohol after you have accident for the burn injury. You can do not put your alcohol in the inside your wound burns. Okay, and okay, the next. After we have first aid for burn, as a nurse, we have nursing management of burn. We have assessment, nursing diagnosis, and the nursing intervention. The first one is assessment. Like a nurse, we have to know what the history taking for burns, the etiology of the burn from cause, the common causes from the electrical, thermal, chemical, or the scalp. The assessment in history taking is like you can ask the patient what the etiology of the incident of the burn. And the second is the physical examination. You can have to count the TBSA or total body surface area. You can use the rule of 9 with which one or which part can affected in the body. And the last is vital sign. The vital sign like blood pressure and pulse and oximetry pulse and the respiratory. Okay, the next is nursing diagnosis. This one there have 4 nursing diagnosis. This only the priority the diagnosis because we have more diagnosis for the burn based on the injury. So we have just put the 4 nursing diagnosis. The first one is impaired gas exchange related to carbon monoxide poisoning or smoke inhalations. And the second is ineffective airways clearance related to edema, so we can control the airway or the breathing. And the third is pain related to tissue and the nerve injury and emotional impact of injury. And the last is fluid volume deficit related to increased capillary permeability and evaporative losses from the burn wound. And the next part is about the nursing interventions, as what we can, as a nurse, we can just do the intervention. The first one is assess breath sounds, respiratory rate before, yes. Assess breath sounds, respiratory rate, rhythm, depth, and the symmetry. Also, you can control monitor patient for sign of hypoxia, because the patient with the burn, you can assess with the ABC, airway, breathing, and circulation. So we can control or monitor patient for the sign of hypoxia. Okay, the third is observe for erythema or blistering of lips, signal still, burn of face, neck, or chest, increasing hoarseness, so and the sputum of tracheal tissue in the respiratory secretion. So if you have some patient cannot to breathe correct well and cannot cannot breathe relax, you can observe the erythema of the bleeding in the neck or in the chest. And the fourth, monitor ABG, volume, pulse oximetry readings, and the carboxyhemoglobin levels. And the last is monitor urine output, at least hourly and the weeks patient daily. So we need to control or monitor balance fluids, so we can continue every hour we can count the balance cairan, so we can control the urine output daily. Okay, this the last topic about wound care management of burn is review treatment option based on the research. In the review option treatment based on the research, I have two recommendation for the treatment. The first one is silver sulfadiazine, or you can call it SSD, and the second is manuka honey, is kind of honey. Next. Okay, in this slide, this my research before in 2020. The result explain silver sulfadiazine or SSD was found to be effective 85.7% of the wound area, so granulation tissue, and 75 to 100% of wound area, so the epithelialization. So if you found the resources about the treatment for burn, silver sulfadiazine or SSD can use for the treatment of the burn. And the data on their wounds were collected 3 times and evaluated by the using the NOC, nursing outcome classification observation method. This my instrument for the collect the data. And the wound outcome were evaluated using on the basis of the wound healing by secondary attention. So the NOC score, the result explained the NOC scores of the burn were examined 3 times during the course of the study. And next slide. Okay. The observe, you can look in the table 1. This is my result of the research before. At the observation point 1, 48 hours after application of SSD, The average NOC score was 17.8, indicating the need for follow-up care and implementation of proper wound according to degree of the burn and wound bed profile. And after 25 days of using SSD at observation 2, the NOC score increased to 27.7, representing advancement of the healing process. So finally, at the observation 3, the NOC score was 35.20. This significant progress in the wound healing. So we can summarize the SSD is still affected to burn care or in the wound management for care based on the result. Okay, the next slide is about other treatment. Next slide. Okay, this is my last slide for honey dressing, or we can call Manuka honey, evidence based on the result by Kanai Mukai et al. 20 and 15. Evidence-based complementary and alternative medicine. You can see if the macroscopic wound healing in the picture A and B, wound of 4 diameter was inflicted, and the healing was recorded photograph, and the result explained. He explained or we found that the wound area of the HCD group increased during the inflammatory phase and then decreased, and that the wound in this group had healed, although they exhibit scarring by day 14. So Manuka honey was also significantly greater than that of the Acacia plus or adding with the HCD group on day 8. So we have 2 recommendations for the review treatment in burn care management between SSD or Manuka honey. Is 2 of the treatment is significant greater or significant greater than that use the Acacia plus the HCD group. So we can just choose the better one for the treatment. Maybe the other speakers from pharmacy can get some review treatment option for other herbal medicine. Thank you very much. Enjoy your webinar. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you so much, Mrs. Estrin, for your slide. You will already present the burn care, and you present about the use of honey and also the use of some kind of SSD for burn care. I think it's very interesting for us to implement in a nursing practice. Okay, so we move to the third speaker. Third speaker will be Assistant Professor Dr. Sukanya.
Hello.
Okay, good morning, Achan.
Good morning.
Okay, can you hear very clear?
Did you hear me?
Okay.
Maybe I increase volume a little bit. Moment.
Okay. Before Dr. Sukanya present her topic, I would like to present her profile. Her name is Assistant Professor Dr. Sukanya Adisai, and she is from the Department of Pharmacognosy and Pharmaceutical Botany, Faculty of Pharmaceutical Science, Prince of Songkla University in Thailand. And her education is he graduated from German, and also she's have a lot of publications in herbal and also For example, in some natural plant in the herbal. Okay, and then we also have some poster. We said in the 5th Prince Sulabon International Science Congress in 2004. And I think a lot of achievement in academic section in her profile. Okay. Okay, Dr. Kanya.
Yeah,
Okay, you will have,
thanks.
okay, you will have 30 minutes to present your topic.
Okay, thanks a lot for my for your introduction about me. So can I share my screen by myself?
Okay, it is okay.
Okay. Did you see that?
Yes, we can see it very clear.
Okay. 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 So first of all, I would like to thank the organizer for webinar to invite me to be the speaker today. So for Indonesia's university, I think I close to be there because several times to visit in Indonesia and also several times for webinar or virtual conference because of the COVID-19. So we cannot see each other on site. We can be only online. Oh, sorry. Today, I respond about the potential of national compound for wound healing. As you know that my specialist is about national products. So that's why on the research or the lecturer in my department is also concerned about the pharmacognosy and pharmaceutical botany. I think I would like to start about introduction a little bit about the wound and the wound healing, because I think the two speakers before also give you the idea and also the knowledge about how come of the wound and the treatment by I think the Western medicine. But in Thailand, is an alternative way. Is we use also natural products. So for the wound in Thailand, I think most of the wound is come from accident. Because we have often that is traffic accident on the street, on the road, and also that now is increasing that the wound is come from diabetics. Diabetics in Thailand we call is non-chronic disease. Yeah, and the patients will be increasing each year. And for our group, we also study about how to reduce or stop the diabetics by medicinal plants also. And the chronic wound also, that is also come from the disease and from the accident also, that is can continue. And in Thailand, as I told you, that now we use also traditional medicine to treat about the wound that is from acute and also chronic wound. I think I heard from the other speaker already about the progressing of the wound or the start or to stop the wound by our body. For example, you can see that we start with breathing, and after that inflammation, and after that proliferation, and the last one is remodeling to recover the wound back in the normal state. So I don't want to give more detail about this because you listen already. But for my responsibility is about the natural products. Why we searching for natural products for the wound healing? Because from the component in natural products, they have many chemical compounds that represent for antioxidant, anti-inflammation, antimicrobial, angiogenesis, and cell proliferation, and the last one is cell migration. For these activities, it can enhance the wound healing. That's why we're searching for natural products, because some natural products, they have many activities in the one plant. So I selected for the most famous or favorite in Thailand that we use for wound healing. And on this medicinal plant also have the evidence base that support to have for the activity also. Okay, first they start with the folk medicine. For the countryside, they use it. And after that, they come to the research. For example, the first one is Centella asiatica. I will give more detail later. The second one is aloe vera. The third one is turmeric. The fourth one is snail mucus. And the last one is honey. And I think the speaker before me also talked a little bit about honey already. And so because of the time limiting, so I can show the example only 5 herbal medicine. We should start with the first one. Moment. The first one that I have to talk about you is about how to know that this plant is can use for wound healing, how to make the experiment or the determination of this activity. Normally we have the wound healing and cell proliferation assay. This you can use in vitro study. We can use the cell line assay. The cell line that we use from the mouse fibroblasts. We call this cell line is L929. In the experiment, we use this, and after that, we try to culture the cell. After culture the cell, we take the experiment we call is scattering. Scattering, how to know that? You can see that we have the cell, and after that, we want to make like a distance between of the cell, and after that, we treat. You can see at the beginning, the distance is so wide, and after we treat with the interesting herbal medicine, we can get we can see that the distance is narrow. It's become narrow and narrow, and after that it can finish no distance. This is mean that the cell can make a proliferation and migration to go to stay together. So this is a step of the experiment to see that the medicinal plant can make a wound healing. You can see that this sketching, and after that it's become better and better at the last one. And so for the test for the cell proliferation, how to determine, we use sulfurolidamine B or SRB assay with the cell L929. This how to detect. When we want to detect that the cell can grow, is get more and more, we take the SRB. This is structure of SRB, and the SRB can attack to the protein in the cell. You can see this amino acid, and after that they will represent the color is a pink color, and if the potential effect, they will show the strong pink color, and if they show the weak effect is a pale pink yellow. So it means that if we have the good cell proliferation, you can see the strong pink color like this, and it's a weak, we like this. And that is the research for the wound healing for the scientific evidence base to support for the medicinal plant that is work or not. Because you know that when you use something from traditional medicine, normally in Thailand, the medical doctor cannot accept about that. But if we show the evidence base that it has a scientific support, they will turn to look, oh, maybe they can use in substitute of the Western medicine. The first one that I will give a talk for you is Centella asiatica. I think in Indonesia, you also have it. I don't know that in Indonesia how to call this plant, but in Thailand, we call bobo. But in the common name, you can call it India pennywood, Asia pennywood. It seems like that. I think normally you also eat it, fresh one. Or also in Thailand, they make like a drinking water. Somebody said it's a little bit bitter, but I think the taste is good. In traditional in Thailand, we also use for wound healing. Up to now, we have many scientific support for this claim that it can be the wound healing effect for this plant. How the mechanism that this plant can be the plant for wound healing, because from the research we found that it can increase the cellular proliferation and also for the collagen synthesis, maybe also good for the woman that getting older and older. You can use also because it can increase the collagen synthesis that we need it for anti-aging also. After that, we also have some research that concern how is the active, what is the active component in this plant. We found that the most active is acetylcholine. You can see the structure like this. It's a big structure. The structure, they have one part that is triterpenoid and the other part is sugar part, and when they combine together we call it triterpenoid glycoside group, and the name of this plant is acetylcholine. If you don't want to write the big structure like this, you can see glucose and lactose. This is the sugar part. So from this active compound, they say that from the research, they have the good healing activity and also collagen formation. And also they can increase angiogenesis for the blood vessel. So that is good for the wound to have the blood to support. In Thailand, or I think in the market, we have like some is we call is medicine, some we call is cosmeceuticals. Why is cosmeceutical? That I say to you that they can increase collagen synthesis. So they can in the market they also selling for the facial face also. But for the wound in Thailand we have Centella acetica cream or the gel, and also some is for the mark. That is worldwide in Thailand. The second one is aloe vera. This is more favorite for the wound. For example, when I work in the pharmacy drugstore, because in Thailand, if you are the lecturer and you are the pharmacist, also one responsibility for you to work in the pharmacy drugstore from the faculty to be the pharmacist. Also, many students is come for the wound, for the burn from the motorcycle. Yeah, and after that we grow the aloe vera in front of the drugstore, and I say to them that, oh, you don't need the medicine at the beginning. You can take the mucilaginous gel inside for this plant, because from this plant, many research support that the gel inside can show the good effect for wound healing. And also in the market, they use for skin cosmetic because they has moisturizing and emollient properties. But you have to be careful for this plant because you can see that for the gel, for the mucilaginous gel inside, between they has a latex. It's a yellow color. That is not good for the skin. If you take it also, it can make allergy for your skin, because that one contain anthraquinone derivative. Is for the yellow latex that normally in Thailand we use for laxative. So it means that they use in the component in the traditional medicine to make for the patient that have the constipation, to make laxative for that. So if that latex is come to the skin, it can make itching and allergy. So have to be careful. Take only the gel inside. Normally that this aloe vera gel is not used for moisturizer and reduce inflammation. But internal use also some they take oral administrative is for anti-inflammatory and hypoglycemia. It's mean also good for the diabetic patients and also hypolipidemia. Also good for the patient that has a hyperlipidemia to reduce the lipid in the blood. And possible use for the skin, also you can use for also psoriasis, because for the people that has this problem, it's difficult to treat for the psoriasis. One of the choice to use is we can use for the gel from aloe vera. In the market in Thailand, we have many formulation, also tablet. But for the cosmeceutical, I think this is more favorite for you. And also they use also for the drinking. And the second one, the third one we call is turmeric. I think you can, in Thailand, we eat every meal with turmeric, because we prefer to have a yellow curry every meal. I think in Indonesia, I saw also that you use turmeric in your recipe for cooking. Turmeric in Thailand is favorite, and also they use for cosmetic because they have the activity is for anti-inflammatory, antioxidant, antimicrobial, and wound healing. The important. For the turmeric, the active compound we call is curcumin. The curcumin is play the crucial step for wound healing process, because they can stimulate the production of the growth factor that is in concern in the wound healing process, and it can management for the wound restoration. So it means that if you use this turmeric, the active compound is curcumin can work to stimulate the cell to growth and restoration, so the wound will be recover very soon. And also we have oral administration for the skin burn to reduce also necrosis. And also they has an experiment to test with the gamma radiation, the burn from the radiation. And they also say that, turmeric is good for that, for reduce the gamma radiation burn also. So turmeric is potential to use for skin burn treatment and wound healing. In Thailand up to now, turmeric is you can see in, I think, every product for skin, for the other activity, because up to now, turmeric is included in the list of essential medicine in Thailand also. But the chemical compound inside are not only curcumin, that inside they have the other also, they have volatile oil. So when you have the turmeric in your kitchen, you will get smell from that also. And the chemical compound, this is if they make experiment, they can take also curcumin, dimethoxycurcumin, and bis-dimethoxycurcumin. On of this we call is a curcuminoid group. Curcuminoid group, you can see that the chemical structure different a little bit. And so after that, they test many activity from this plant, but the most favorite of curcumin in Thailand, not only for wound healing, they use also for peptic ulcer, because they can use to increase the bile secretion, and also they make to increase the mucus in the stomach. In Thailand, up to now, the medical doctor use turmeric instead of omeprazole in the hospital or in the clinic. That is effective because they also has volatile oil that is active, like antifatulant. Normally for the patient that has peptic ulcer, they have also the fatulant, and also they get pain in the stomach. So turmeric can make two action to reduce the peptic ulcer and also flatulence also. And however, you have to be careful for the people that use for this. If the patient has a bile duct obstruction or sensitive for this plant, also have to be careful. And warning that if you want to use this plant, must be under supervision of the physician. For example, the people has a gallstone or pregnancy or the children, because it's no efficacy and safety report at the moment. And also the people that use anticoagulant and antiplatelet. And also that the people that use drugs that metabolized by cytochrome P450, or we call it CYP, because curcumin inhibits CYP3, 4A4 and CYP1A2, but stimulant CYP2A6. So the pharmacists have to concern when the patient have to use together with the other medicine. In Thailand, normally the people think that it's safe to use herbal medicine, but we have to ask the patient also, if you use a chemotherapy and you want to use together with turmeric, we have to say that you have to concern if you use doxorubicin, comitrine, cyclophosphamide, and comsoticin, because curcumin can inhibit this activity of the medicine. And the last one, the people can also have the side effect for this plant because it has skin inflammation from the allergy like this. And we have the quality control to control this plant in Thai market. Before you make the medicine from this plant, you have to send to the lab and determine the curcuminoid that must be not less than 5%. And also the oil, not less than 6%. If they can pass this, you can use this in this to be the medicine. Next one, oh, the time limiting. Okay, I go fast. Snail milk cast now is favorite in Thailand because from snail milk cast, you can be for the cosmetic and medicinal product at the moment. How they use that? They can use snail milk cast for burn, for local anesthetic, for wound healing and skin care. In Thailand, at the moment, they also have a farm, a snail farm, and you will earn more money for this farm. It's amazing. For the snail, they have a menthol gland that can secrete the mucus. And after that, they take the mucus from this snail. Many species of the snail that we use to get the mucus. For example, Chatina fusca, this is giant African snail, and the other also the big one. Normally not, we don't take the small one. How they work that? We say that chemical in the snail mucus, they have cilantrine, glycolic acid, collagen, elastin, protein, peptide, vitamin A, D, and E. So the snail mucus can use for wound healing because they enhance the speed and the efficacy for wound healing, and they also regulate cellular aspect for the wound healing process. For example, they can make proliferation and remodeling. So this is good for the wound healing. And this is the example of the research paper that support for the snail mucus to use for the burn or the wound, and also they has antibacterial activity also. And this product in Thailand, I'm not sure this is also famous in Indonesia or not, but in Thailand it's famous, and also some product is come from Korea. The last one is a honey that someone on I think the second or the second speaker also talked already about honey. Honey also has many paper to support that they also can use for wound healing. How come of the honey? The honey is come from nectar of the flower that produced by bee or other insects. What is the inside? Chemical inside is composed with carbohydrate, water and protein, and the other a little bit And in the folk medicine, they use for wound treatment. And after that, they has a clinical trial in the preclinical study and clinical study in the wound injury, include burn, surgical wound, and infected surgical wound and malignant wound. And so after that, they found that the honey wound management is because they has antimicrobial activity, and also they has it's good because up to now they don't have the resistance for the microbial for the honey. Because normally when you use antibiotic, when you use a long time, we get many report that this antibiotic is resistant by some microbial. But up to now for honey, we don't have that report. And also less sticky when we compare with the other wound dressing. And no allergic reaction and side effect report at the moment. How they enhance the wound healing property, because it can increase the immunomodulation and also anti-activity. That is really good for the body. That okay, normally for anti-activity also good for cosmeceutical, not only for the wound. I think interesting to take the honey for cosmeceutical also. But for the honey, difficult to stand up like the honey, because it's many variety of the plant that has a that the bee is go to make the honey in that plant. And also we have to concern about the high sugar content. High sugar content and when you use for diabetic patient, because if they had the wound and you use a honey for that the wound for the diabetic patient, it can be that that area is more sugar, and also the sugar also the source for the food for the microbiome also. That is, you have to be careful. And sometimes in the market you get the fake honey, not the real honey. It's not only come from sugar, not from the honey. And also that is sustainability for honey harvesting. I think for the harvesting is difficult. We need the specialist for this one. At the last one, I have to say that Telemokase for thank you, ขอบคุณค่ะ. And if you have the time for 5 minutes, I would like to show about my university also, because at the beginning I see from your university presentation already. So you give a chance for me to show that. I have video for 5 or 6 minutes.
Yes.
Okay, so I stop on this and I share the other one. Okay. Did you see that?
Not yet. Maybe you can click to play.
Moment. You can see that I share that? No, not yet. Okay.
You can try again and then click play.
You see that?
But
No.
Click play. Not yet.
Wow. Moment. Did you see that?
Yes.
Or not?
We just see this only in the file, and you not choose how to.
You see already or not?
Yes. Just click the one of the file.
You see or not?
Click one of the file. You just click.
You see the video.
Okay, you can try again. You can share again.
Moment. You cannot see that?
Not yet. We can see anything.
Not yet. Okay, moment. Why? I think I share already. Okay, moment, share once more. It's a movie. Contains sleep multiple winter.
Is it movie about the Prince of Songkla University?
Yes. Can I share? Did you see that?
Yes, play. Yes, play.
Okay.
Okay, yes, this looks good. Can you maximize the picture? Maximize the picture.
I maximize already. Did you see maximize?
Oh, okay, yes. I think this is fine. But we cannot hear the sound. We cannot hear the sound of the picture.
Just made me outcomes as the most aware of the 45 instances of the nation as the first university in its time towards the status as one of the top 5 universities. National Research University, as well as world-class universities dedicated about 2011. With its 5 campuses located across Thailand. Sources. The creation of diverse networks of researchers they are such
Okay, thank you so much. That was this very beautiful
Okay.
picture from Prince of Songkla. Yes, we can see all the picture of Prince.
Okay, thanks a lot.
Thank you so much. And then we move
Okay.
to the last speaker of this webinar. And
Yep.
can you see the picture? Okay. And she is Mrs. Ratna Wijayandri. Can you show the profile? Okay. And he's a pharmacy lecturer in Department of Pharmacy, Faculty of Health Science, Universitas Muhammadiyah Magelang. And he's graduate from the Gajah Mada University, and also he has a lot of publication in a natural plant in pharmacy. And the research area in a development of honey kersen leaf extract ointment combination as local natural ingredient for wound healing, and also study in preparation for spray gel combination for wound healing as well. Okay, she will present about the, can you see the slide?
Okay, thank you, Mr. Adi.
Okay, wait.
For my opportunities. Assalamualaikum warahmatullahi wabarakatuh. I'm much obliged for the opportunity. Good morning, everyone, and all speakers. Let me introduce myself. My name is Ratna Wijayandri. I am a lecturer in Faculty of Health Sciences. In this session, I want to explain about herbal drug delivery and wound healing. I hope my explanation useful for all participants here. Before going into my presentation related to natural drug delivery for wound, I will explain little about wound and step of wound healing. Maybe before Mr. Muhammad said more explain about that, but I want explain little about wound. What is wound? A wound is a damage of living tissue or disruption in the epithelial cell of the topmost layer of the skin. A wound may bring about the opening and breakdown of the skin, and it may also cause disturbance and psychological function of the skin. Next, okay. There are three-step process in wound healing. We can see in this slide. Each of step is characterized by a series of events. Inflammatory, proliferative, and remodeling. And inflammatory phase is a second line. Next slide. Inflammatory phase is a second line of defense against infection by pathogen. In this step, there are several processes, namely homeostasis and angiogenesis, phagocytosis. The homeostasis phase, in the phase where the bleeding stops, marked by the release of platelet into the wound area so that the bleeding can stop. In addition, vasoconstriction occurs so that blood vessel will be closed. Okay, and this phase also occur before slide. In this phase also occur phagocytosis process. In this phase, the blood vessel will be vasodilated with provoked by the occurrence of wound that release histamine. You can see all histamine out from this area because of the wound. And then this histamine will initiate vasodilatation, which cause macrophage and neutrophil to come out. This macrophage will destroy bacteria and debris so as to help clean the debridement. Okay, next slide. And then after inflammation phase, there are proliferation steps happen. In the proliferation process, there are several stages here, namely angiogenesis, or the formation of new blood vessel, granulation, where fibroblasts from granulation tissue, collagen synthesized by fibroblasts, and then epithelialization, or the formation of new epithelial cell in the wound area. Both of epithelialization and granulation, there are some different, which will later meet into new tissue that covers the wound. We can see a scars here because of the natural process of the wound healing. And this point is one of the target for exploration of herbal drug. This process of healing are known, next slide. This process of healing are known to be influenced by several factors, such as infection, nutrition, drugs and hormone, type and size of wound, and certain disease condition. Wound management, next slide. Wound management and the efficacy of wound healing influenced by the injured tissue and their material and wound healing. Next slide. Again, with wound healing potential, which are obtained from natural and synthetic bioactive material, have the propensity for antioxidant, chelation, and antimicrobial activity, and may act by one or more of this mechanism. Okay, next slide. We can see together on the chart the effectiveness of various ingredients from plant on wound healing. Ms. Sukanya, before also more explain about that. I want to present about that. There are many various phytoconstituents here that have role and healing and wound healing. There are and various plant extracts have shown increased DNA production and total collagen enhancement in the wound site. And then in remodeling phase, phytoconstituent like flavonoid, tannin, monoterpene, alkaloid, and phone to increase rate of wound healing through collagen synthesis. Heteropolysaccharides such as arabinogalactan and rhamnogalacturonans are believed to enhance epithelialization and remodeling. And then in proliferation, there are various plants have found to show mitogenic activities, this promoting angiogenesis and increased blood supply to the wound. In inflammation phase, there are also many activity here, like terpenoid, phenolic acid, and anthocyanin process, antioxidant, and antimicrobial activity. Okay, next slide. This phytoextract can be used to formulate into various dosage form to be applied topically on the wound area. This phytoconstituent work by complex mechanism with minimal side effect. Apart from the conventional dosage form, novel drug delivery systems are being developed for incorporating this herbal constituent and delivering them to the wound area in a more targeted and sustained manner. Okay, in this slide, this is a dramatic shift has been seen to study herbal drugs as a potential approach for wound healing, such as chemical compounds show more adverse side effects, increasing of resistance in antibiotic, and then the topically used antibiotic and antiseptic are also associated with side effect or adverse effect. Natural drug, more safety, effectiveness, and minimal side effect. And a conventional drug, there are many things here. Conventional dosage form limit their effectiveness and decrease bioavailability. This phytoconstituent is isolated as a single and purified compound can be easily incorporated in novel drug delivery system. Drug delivery systems have been developed to minimize the drug degradation process and to minimize harmful side effects and to enhance the drug bioavailability. Next slide. There is also need of such drug delivery system which may control the pharmacokinetic or pharmacodynamic non-specific toxicity and effectiveness. Novel drug delivery systems solve the problem which are associated with conventional delivery system of herbal drug. There are various new drug delivery like nanoemulsion, phytosome, liposome, nanofiber scaffold. Yes, several forms of biocompatible drug carrier are used in control drug delivery system, including nanoparticle, nanoemulsion, nanohydrogel, nanofilm, and nanoliposomes. The systems are capable of diminishing the side effect and increasing the efficacy of different therapeutic agents by providing a sustained and controlled delivery system. And they increase the dissolution rate of the drug based on their surface characteristics. A delivery system for wound healing must have this criteria. Should perform the function including maintaining its activity by protecting itself by proteolysis in wound area, and then available at localized and avoiding getting diluted in the wound fluid and getting absorbed and distributed systematically, releasing the drug within the wound area at a rubber rate and duration. Some free drugs have problem of low aqueous solubility, narrow biodistribution, rapid degradation, and fast clearance. Such drug can be encapsulated into nanoparticle. There are the foremost method to produce nanoformulation from different natural products. The nanoparticle exhibit two types of drug release pattern. The two mechanisms were found to be diffusion and degradation or erosion. The wound healing potential was evaluated to use the splinted moss full, next slide, full thickness excision model. The animal group treated with PLGA curcumin nanoparticle was found to be recovered almost completely by the 10th day, whereas the group which received curcumin only and PLGA nanoparticle only showed around 75% recovery. In this image, we can see F encapsulated curcumin nanoparticle particle for wound healing give better than nanoparticle curcumin only or PLGA only. There are decreased inflammation and increased epithelialization and increased collagen deposition.
here. Next slide. This is also the example for advanced drug delivery system containing herbal component for wound healing that accelerate wound healing by the application of herbal nanocarrier. Yes, in the last slide, this is a process to make nanoparticle uniform self-assembly PLGA core microsphere SCS or alloy film was fabricated via an assay one-step pharmacoemulsification. The core combined releasing cytosan or alloy film showed excellent biocompatibility and biological properties which exhibit promising regenerating potential. Various novel herbal wound healing formulation like microsphere, nanoparticle, liposome, nanoemulsion, nanoparticle, nanofiber, hydrogel, and dressing. This novel formulation not only cover the wound, but also stimulate the tissue regeneration and remodeling. They also speed up the regeneration of skin, thus minimizes the size of scar and its formation. This herbal drug work by various mechanisms and help in the healing of wound in a more efficiency way. The disadvantage of antibiotic resistance and serious adverse effect is also minimized while using herbal approach for wound care. Thank you.
Okay, thank you so much, Mrs. Ratna, for your presentation. This is very interesting topic in this webinar. Okay, now we move to the question and session. Now we will let all the audience would like to ask to the participant for any questions. You can ask directly or you can write in a chat box and we write and send to the speaker as well. Okay, maybe any questions? Okay, can you open the chat box? Chat box juga, Mas. Chat box. Okay, there's still no question from the audience. Okay. Okay, maybe you will, anyone who ask directly to the speaker. Okay, can you scroll? Okay. Okay, we still wait from question from the audience. Yang mana? Kabar Dana, okay. Okay, Mr. Perdana Priya, would you like to ask to the speaker?
Okay, thank you, Mr. Ati.
Okay.
Is it clear?
Yes, very clear. You can ask to the...
Okay, I would like to ask to Mrs. Sukanya. Thank you for the interesting presentation. And maybe for the first one, I would like to ask about, you mentioned before that we have centella, and then aloe vera, and then turmeric, right? And it quite it's abundant in Thailand and in Indonesia. So my question is it possible, especially in Thailand, use centella, aloe, turmeric, etc., as a first aid for burn? Because sometimes we got bone, cut or something like that, and is it easy? It's kind of easy to use it for the first aid. Is it okay, or is it possible? And then the second one is, I'm interested about the snail mucus for wound healing. Is it only we take the snail mucus and then we rub it or put it on the wound, or is it any additional substances to add the snail mucus for wound healing? Maybe that's my question. Thank you, Mr. Adi.
Okay, thank you so much, Mr. Perdana Priya. Dr. Sukanya, can you see the question from Mr. Perdana Priya?
Thank you for the questions. I got, I think, only the second question because I just back from the last room. For the second question about the snail mucus, right?
Right.
That you said from snail mucus, we can add the other component inside or not? You mean like that?
Yes, yes.
I think you can combine with the other, but in the market normally they use snail mucus. It's like the base that we use snail mucus, and you can maybe add aloe vera, or you can add the other AHA or hyaluron or something like that to make a high value for that. For example, normally if you use snail mucus, the cost is cheaper than you add the other. When you add the other component, the value of that, the cost for that product is will get higher. It depends on which one. For example, you say that this is for anti-aging. You can add hyaluron, or you can add curcumin or something like that, and you can promote that this is for anti-aging, anti-wrinkle, or whitening. For example, you say the whitening agent, because in Thailand, for the cosmeceutical, they prefer for the anti-aging and whitening, because we prefer whitening. The opposite way with the European people, they like a sun tanning. And the first one, the first question, can you ask me once more? I did not get it.
Yeah, is it possible to prepare the centella, aloe, turmeric, etc. as a first aid for burn? Maybe especially in Thailand.
Normally in Thailand, we in the countryside or many house, they grow the aloe vera. They grow at home, and after they have sunburn, they just only cut it and take the mucilate inside the gel. But you just only be careful that don't take the yellow latex. Normally in you take the clean out, the outer skin out, and take only the white gel inside. And after that, you take immediately to the wound. Yeah, that is really good. After that, your wound is not become bigger or have inflammation or something. They can reduce it. Anyway, if you don't have anything, you just only take ice to the wound. Yeah, but in Thailand, they prefer the toothpaste. The toothpaste that to the wound. But in front of our drugstore, we have also faculty drugstore. We grow the aloe vera, and after that, the student, normally the pharmacy student, they must have the wound at the leg because the motorcycle. Yeah, and the motorcycle, you know that sometimes your leg is touched on the hot area. Yeah, and after that they come to the drugstore and say, oh, teacher, it has a wound, I will have the scar or not? And I say, yes, you will have it. And after that I say that, oh, okay, you have to take the aloe vera in front of our drugstore and place on over your wound to stop the pain and hot paste. Yeah, that is good. And also for the sunburn, sometimes we go out, and in Thailand it's really hot, and often that we have this burn from your face, and when you back to your room, you can use also aloe vera or cucumber also possible. Yeah, you can go to the kitchen from your mother and take cucumber and slice it and place in your face, Yeah. And if you don't have cucumber, you also use aloe vera. You can use both. It's good also for the sunburn. Yeah. In Thailand, many choice for the wound healing or sunburn. Yeah, but the time limiting, I cannot tell you all of that. Yeah. Thank you for the questions.
You're welcome. Thank you for the explanation.
Okay, thank you so much for the answer, Dr. Sukanya. And then we have
Welcome.
Okay, we have another questions for Mrs. Ratna. The question comes from Putri Devitasari. Okay, there are two questions here. Okay, the first question is what should be considered in developing isocure for the wound. Okay, and the second question is what the advantage of the INADDS, especially nanoparticle for the wounds? This question for Ms. Ratna.
Thank you for the question. What should we consider and develop dosage form for the wound? The deep understanding of the pathophysiological of wound has resulted in the development of various novel drug delivery system here, which may not only provide physical protection to the wound, but also maintenance adequate moisture in the wound area. Enough? And a second question, what the advantage of novel drug delivery system, especially nanoparticle for wound? The system are capable of diminishing the side effect and increasing the efficacy of different therapeutic agents by providing a sustained and controlled delivery system, and they increase the dissolution rate of the drug based on the surface characteristic. Maybe this is my answer, Mr. Adi.
Okay, yeah, I think your answer will help the Novitasari to understand what is the topic is. Right? Okay, the next question is from and to Mrs. Astrin. What is the nursing intervention for the emergency care of burn?
Okay, thank you for the question. The question is, what is the nursing intervention for the emergency case of burn? There are three intervention for the emergency case. The first one is promoting gas exchange and airway clearance. Can provide the humidifier oxygen, like monitor arterial blood gases, pulse oximetry, and etc. And the assess breath sound and respiratory rate, like rhythm or depth and symmetry. And also can monitor for hypoxia, and then observe for sign of inhalation injury. And the second is restoring fluid and electrolyte balance, like urine output or intake, like a balance cairan. You can control or monitor vital sign and urinary output. It's hourly. And the central venous pressure, or CVP, pulmonary artery pressure, and cardiac output. And the last, you can maintain for the temperature, body temperature. You can also provide warm environment, like assess core body temperature frequently, like you can heat shield or blanket or etc. I think there are three intervention for the emergency cases: promoting gas exchange and airway clearance, and the second is restoring fluid and electrolyte balance fluid, and the maintain normal body temperature. I think this answer.
Okay, thank you so much, Mr. Estin, for your answer. I hope it will help Mrs. Fitri to understand the question. Okay, maybe there is another question. Maybe for Dr. Mosaid. Maybe we still wait the question. Okay. Okay, we still wait another question from the audience. Okay, there is no question. Okay, we wait. Okay, there's a question from Mr. Arif Kusuma. He asked for Mr. Mosaid, how is the synergy if the wound management between anti-proliferative and antibacterial and anti-inflammatory? Okay, Dr. Said.
Yeah, thank you for the questions. You're asking me how are these related? Yeah, how synergized between the management of anti-proliferative, antibacterials, and anti-inflammatory. But to be very honest to you, all this could be a prophylaxis first. Okay, can be a prophylaxis, but unless you choose a very strong or what we call a very complicated wound, otherwise all of this not required. Basically can be managed by natural way, but the natural way have to come along with what I mentioned earlier is factors of good blood returns, blood circulations, diets, and supplement, minerals, vitamins, all will work out. Other than that, this will never, not any issues. Okay, so it's quite difficult to work out. For example, if you ask someone who are on antibiotic, antibacterial drugs, they are just to enhance the treatment, to expedite the treatment basically, but it is not a mandatory. That's how I can conclude with this question. Thank you.
Okay, thank you so much for the answer, Dr. Mosaid. I think it's very clear to Mr. Arif understand the question and understand about the topic you present in this webinar. Okay, maybe another question from the audience. Okay, we still wait a moment for the question from the audience. You can write the question in the chat box or you can ask directly to the speaker. Okay. Okay, I think there will be one questions. No question, okay. I think maybe I will ask a question to Dr. Said maybe. And how can we collaborate with another profession when we deliver wound care in hospital? What is the step to doing some collaboration with the other professions?
Yeah, if you look at the interprofessional or multi-professional, in terms of wound care, I always say that wound care is not belongs to the one single discipline. Okay, if you look at the plastic surgeon, they also talking about wound. You're talking about a surgeon also deal with a wound. If you talk about podiatry, diabetes educators, they also deal with the wound. Emergency also deal with various type of wound. Burn unit also with wound, ICU, trauma. So I think at the end of the day, who is champion is a very subjective, but I think it belongs to every discipline. Everybody is indispensable. Every profession is indispensable in terms of treating the wound. So if I'm asking Brother Sumardo the question, I will say that we bring a team. Okay, if a person who are having a vascular problem, what kind of the teams require, how we're going to do the a kind of dressing, if surgical, a clean wound, dirty wound, trauma wound, I think all of them will have agreement of sit down, together and make a better. Or you can ask one another. For example, physicians treat diabetes with colitis, but the wound are not healing according to his way of managing. By all means, he can go and move to the next discipline and ask the view, and what are a drug requires or solution requires. So I think all again, we need to have a team if you cannot solve the problem. Like if you ask about me, pain, we have a pain management team in the hospital, and it's conquered by the anesthesiology, Dr. Bius, Pakar Bius. But when talking about wound, I think the wound team is a very broad. Even stomach care is called wound team. Wound is a pressure ulcer is a wound, burn is a wound. So again, I think it depends on how you work, your organization. But at the end of the day, if the problem not solved, try to get their view. Inshallah, it works better. Thank you.
Okay, thank you so much. So I think you mean that we need some team in hospital, maybe some kind of surgeon and maybe a diabetic specialist as well. Okay. Okay, there is another question to Dr. Said. It came from, there are two scales that we use for the risk assessment. So how do we choose and how, or we can choose it randomly? Maybe there's some consideration how to choose the scales.
Actually, there are many. I just took two, I will give example. So when we would like the reasons why the scales are available, like Glasgow Coma scale, we want to tell something objective, clear, and is agreeable by all the parties, because the nature in the healthcare sector or in the healthcare fields, we are dealing with so many people to giving the data, to giving the information. So we would like it to be very reliable, valid, and objective. Therefore, all the skills are coming. Remember, the skills are not only talking directly on the wound, but the scale also talking on the factors that I've mentioned earlier, talking about any risk, mobility, and etc. Even don't talk about pressure ulcer. If you are post-surgery and you're having your wound yourself, a clean wound, but the healing very much affected by your diet and as well your mobility. Therefore, if you notice in the surgery management, they will ask as early as ambulation. And those are an example. So those scales will giving an indicator what are the rate at the present, because it will tell the factors as well on the wound condition. So if you ask me, there are many scales that you can use, and whatever your hospital, some hospitals, they come up with their own way, and some have whatever they adopted, but it's just tools to give objective information.
Okay, thank you so much, Dr. Said. Okay, is there any question from the audience? Okay, I think Mr. Rana would like to give some question to the speaker.
Yes, thank you. I have one question for Mr. Sukanya, Miss Sukanya from Thailand. It is interest material and inspiring for me. My question is, there are so many products that are very interesting and become a solution for wound here. Can you explain the process of the product resulting from the research until it can be used by consumer? Thank you.
Excuse me, I'm not sure that I get to a question or not. You mean that the extract from the plant or the product in the market, that is a solution? Once more, please. Excuse me, yeah, sorry.
Okay, thank you, Miss. I have one question. There are so many. Can you hear me?
Yeah.
There are so many products that are very interesting and become a solution for wound here. Can you explain the process of the product resulting from the research until it can be used by consumer? Thank you.
Normally in Thailand, when they prefer, they will make a research from the medicinal plant by take the extract. the extract from the plant at the beginning, and after that they will make experiment that I show you for the cell proliferation, yeah, by using the cell line. And after that, if it can make a cell proliferation, so it means that they show the good result. They will take this extract to formulate. Maybe before some people, some research group, before the formulation, they also make the next experiment in vivo. In vivo is mean in animal model. They will use in the maybe the skin of the mouse. And after that, if it show the good result in the animal, also they take the extract for formulate. It's depend on interesting for them. Some they formulate in the cream, some they make is a gel, some they make like the how to say this peel off skin. It means that you can see some formulation that they just only cover the face, and after that take out from the face if you have the wound. So it's many formulation in Thailand that they use the extract. So it depends on, because they has the good color. They also can use in the gel, but some they have not the really good color, because when you use it when you formulate in the cream, when you apply to the skin, and if they have a bad color, for example, it's a very clean color, and you apply to the wool at your skin, and you have the clean skin, and that is not good. So they try to apply in the other formulation, for example, that to the layer, add to the plaster like you understand what I mean? Tensile pass, for example, tensile pass, the plaster to cover to the wool, and inside is that the extract, because you cannot see the color of the extract. That is not so nice. But if the extract is so beautiful, for example, turmeric is a yellow color, and when you formulate when you apply in your skin, it's also look a little bit yellow. It's okay, because we also not have the white color skin. We have only a little bit dark skin, so it's come together with the yellow skin. It's become more bright, so it's okay. Yeah, so it depends on the extract that in Thailand they formulate about that. And for example, at the beginning for the snail mucus, when you want to add snail mucus, is a white color, is no color. So when you add some extract for synergistic effect, for example, you need you add the Centella asiatica, is a green color. Sometimes you have to get rid of the green color from chlorophyll before. How to do that? In the formulation, we add charcoal, activated charcoal, to absorb the chlorophyll out of the extract. And after that, you can, after getting rid of the chlorophyll, you can take that extract to your cream base or gel base. So your formulation will look better. Yeah. So why in Thailand they have many kind of formulation, because they try to get the best one in the market. And when it is a cosmeceutical, they don't take like medicine. It's to register for the FDA. But if you claim your product is medicine, it's difficult. So for the wound healing in Thailand, normally they register like a cosmeceutical. So it's more easy. That's why in the market we get more products. I don't know that I answered your question or not. Did you get it or not?
Yes. Are there maybe I have one answer again? Are there some regulations?
Yeah.
Are there some regulation that must be passed to be able to market the product? Or is it
Yeah.
collaborating with our industry?
Yeah. For example, that if you they have two kinds. One is a medicine, the other is a cosmetic. If you say that your product is a cosmetic, you just only go to register. They have online registration. It's like one-stop service by online, and you pay for the register, and it's after that it's finished. That if you claim that your product is cosmetic, but if you claim that your product is a medicine, so for example, you say that this product is a external use product for wound healing, for something like that, you have to register to FDA, Thai FDA, and you must have the clinical trial, and you must have animal result, clinical trial also. It's very difficult. Normally for the wound healing in Thailand, they will register like a cosmetic, and they say that only for the healthy skin. They don't say that it is for anti-inflammation or is an antioxidant or this is for wound healing or something like that. No, they don't say like that. They can say only that it's for healthy skin, to improve your skin. That is okay for cosmetic. But if you say the activity exactly, for example, you say that it's for anti-inflammation, this is for wound healing, this is for analgesic or something like that. No, you cannot register for cosmetic in Thailand. You have to register for medicine. And for medicine, it's difficult. You have to get the data from animal model and clinical use also. That is for Thailand. We escape that way. We go to the other ways for cosmetic. I don't know that is same in Indonesia or not. Is it easy or difficult to register for the FDA?
Yes, the same regulation may be here. Yes. Thank you.
So in the market we have more cosmetic, or
Zoom-nya. Okay.
I
There is
think
one
they have the question.
Yes, from Dr. Sukanya. Do you have any
Yep.
experience using herbal medicine for wounds in type 2 diabetes?
Normally in my experiment, for example, if the patients come to the drugstore, I prefer to suggest them to use aloe vera. Also, if in the Western medicine we use Insta gel, you know that Insta gel for the wound, for the wound from diabetics patient. But my expert for diabetics is about how to reduce the hyperglycemia. Normally, I use medicine also, herbal medicine also, but the experiment in our lab group to reduce the hyperglycemia, reduce blood sugar. But for the wound healing, just only has experience in the drugstore to say to them that, oh, you can use aloe vera gel to, normally for the diabetic wound is, how to say that, it's not so nice wound because it's difficult to treat. We need also that to make a cell proliferation, and also we need also that the medicine for antimicrobial, because they has also infection in that area. So the best one is aloe vera. Aloe vera gel is the best one for that wound. In my idea, in my experience, I think for the herbal medicine. Yeah, and sometimes when you look the diabetic wound and they has also infection, you need also herbal medicine that has also antimicrobial. Also, or you have to use a Western medicine for antibiotic. Also together, we cannot use only herbal medicine. Sometimes we have to combine together with Western and herbal medicine. Yeah.
Okay, thank you so much. I think using aloe vera will help for the patient with wound type 2 diabetes.
Yeah.
Okay, thank you so much, Dr. Sukanya, for your answer. Okay, I think.
Thank you also. Yeah.
I think there is no more question again. And before closing this session, I would like to conclude that when we are giving care for the patient with wound, I think we can collaborate with the pharmacy. We can give some intervention to the patient with the medicine or using herbal medicine. Okay, I think it's enough for the session today. And thank you so much for Dr. Mosaid and then Dr. Sukanya and for the two speakers from Indonesia, Mrs. Ratna and also Mrs. Estrin for the wonderful presentation today. And thank you so much. And Lala, it's now your turn to lead this. Okay. So would you mind to wait a moment to Dr. Mosaid and also Dr. Sukanya?
Yep.
We'll take a picture.
Uh-huh.
Thank you, Mr. Adi, and all the speakers for the wonderful discussion. So we have a lot of new knowledge today. For the next session is giving a certificate as a speaker to our speaker from Thailand and also from Malaysia. So for the first, this is the certificate of application for Dr. Mosaid. The next for and the next session is giving certificate as a speaker to our Indonesian speaker to Dr. Heni Setiawati Estirahayu. The time is yours. And the next, a giving certificate for our moderator. Thank you. Thank you. So for the next session is a photo session. So to all of participants, may open your camera. Okay, for all participants, please may open your camera. Okay, so in the count for 3, 1, 2, 3. Okay, once again. Okay, please prepare. 1, 2, 3. Okay, thank you.
Thank you, Dr. Said, Dr. Sukanya. See you next time.
See you next time. Thanks a lot.
Bye-bye.
Bye-bye.
Thank you, everyone. Assalamualaikum.
Bye-bye.
Then we move to the end of this event. I would like to say thank you to the director, Dean of the Faculty of Health Sciences, and all of the committee, and also to all of participants for joining us today. Thank you so much, and I hope we will meet again in the coming webinar. Wassalamualaikum warahmatullahi wabarakatuh.
Faculty of Health Science is one leading faculty at Universitas Muhammadiyah Magelang. Faculty of Health Science Universitas Muhammadiyah Magelang is located on Jalan Mejen, Bambang Sugeng Pertayudan, surrounded by refreshing cool air. Faculty of Health Science Universitas Muhammadiyah Magelang is the development of nursing diploma which was established in 1993. Faculty of Health Science is committed to generate a professional human resource in the health field, educate intellectual generation who are creative and innovative. As stated in the Faculty of Health Science vision, becoming an Islamic, innovative, and excellent at the international level. Faculty of Health Science Universitas Muhammadiyah Magelang has 5 programs of studies. There are nursing profession program, nursing graduate program, nursing diploma program, pharmacy graduate program, and pharmacy diploma program, which are leading and most favorite program studies for high school graduate. All programs of studies have been accredited by LAM-PTKAS. One has been got very good and the other has been got good accreditation. In Faculty of Health Science, Universitas Muhammadiyah Magelang, the lecturers are qualified lecturers from within and foreign country. Faculty of Health Science has complete facilities with a modern environment and also have support infrastructure, makes conducive atmosphere for learning activity and student activity center. To support the teaching and learning process, there are nursing laboratory, mini hospital, Woundcare clinic, IAG laboratory or natural science laboratory, pharmacy laboratory, chemistry laboratory, library, computer room, and free Wi-Fi in all area. Faculty of Health Science also provides opportunities for students to participate in organizations such as UNIMMA-Universitas or Nursing Student Association, ERT or Emergency Rescue Team, HIMAFA or Pharmacy Student Association, INM or Muhammadiyah Student Association, TPM or Student Representative Council, and PAM, Student Executive Board. The graduated students of Faculty of Health Science Universitas Muhammadiyah Magelang can work in the hospitals, clinics, health centers, and health staff in foreign countries, mainly in Japan and Singapore.
So what you waiting for? Let's join us in Faculty of Health Science Universitas Muhammadiyah Magelang.
Islami, inovatif, excellent.
Indonesia, a heaven on earth, the land of immeasurable diversity. And this is Magelang, a beloved land. The universe provides many beautiful places with the wonders of the world. UNIMMA present to be a milestone in facing a more competitive and inclusive era. With the prophetic spirit, ethos, and motivation, UNIMMA is ready forming the quality people based on Islam, affording the excellent graduates in science and Islamic in behavior. Welcome to Universitas Muhammadiyah Magelang. It has 7 faculties with 21 study programs. Faculty of Economics and Business, Faculty of Law, Faculty of Education, Faculty of Islamic Religion, Faculty of Engineering, Faculty of Health Sciences, Faculty of Psychology and Humanities.
Established on August 31st, 1964, UNIMMA continues to be committed in forming an excellent and Islamic generation from various backgrounds. We have succeeded in building an intellectual that enriches and enhances humanity as a contribution to the nation.
For the superior generation, UNIMMA is supported by advanced technology facilities for industrial research and development. Standing in a strategic location, our campus is very accessible even for people with disabilities. This is a manifestation of an inclusive educational environment. Maintaining a commitment to the environment and society, UNIMMA always takes concrete actions to create synergy and collaboration with community. In addition, UNIMMA also partners with stakeholders and the industrial sector to facilitate and provide convenience for the students. Is unique with different talents and interests. Therefore, UNIMMA provides opportunities for students to develop themselves to be the best through their interests and talents, both academic and non-academic. We embrace our diversity, growing the future together for Indonesia and for the world. UNIMMA, moving and inspiring.